My name is Denise Krebs, and I am the product launch and project manager here at Virtual Clinic, and I'm super excited today to bring you some information, some training about a new offering that we have on Virtual Clinic, and it is called an M3. And this M3 was developed by a team of scientists and researchers, and then partnered with Dr. Tony Brown here at Virtual Clinic to bring this to the masses. And so today I get to walk you through what it is and how to do it. So what you're seeing on the screen right now is a page from a document that I'll show you where to find in the clinician's portal. But you can see that this M3 product is a very fast, so 3 to 5 minute assessment that any practitioner can use to help identify mental health conditions. So it's a screen to help you as a clinician better serve your patients and clients. So you'll notice on this screen comparison with other assessments that are out there. And this one assessment that has 27 questions, takes 3 to 5 minutes for an individual to complete, evaluates, screens for depression, bipolar, anxiety, PTSD, substance misuse, functional impairment, and suicide. So let's dig into this assessment and how to access it on your portal. I have gone to the virtualclinic.md, and I am going to log in as a clinician. So this is the dashboard, and you see here's a little bit of information on the dashboard when you log into your portal. So this document that I was just looking at is found here under resources. There's one about M3 information that takes you to this overview of the document. It's a PDF. And then it walks you through that. The second document that you'll find under resource is how to use the M3. This is the document that we were looking at just a couple of minutes ago. It's a PDF document that walks you through more specific detail on what it is and how it came about, what the information tells you, and then a little bit of information about the actual test and the questions. So let's get into how do you order this test. Once you get into your Virtual Clinic login, you're going to order this test just like any other test. You go to test order client, brings you to the all test. And if you want to trim down those tests, go to browse by lab partner and pick M3. And it'll bring you the 6 different types of M3s that we have. So basically there are 3 different M3 tests. The first M3 is this one that simply says M3 checklist for mental health. And you'll notice there's a sample report if you want to look at that, and a validation article. Now this test right here is simply that 27 question M3 test. We also have NIDA for substance risk, and PEG scale for pain. For ease of ordering, we have done every single combination you can think of with M3 and PEG, M3 and NIDA, PEG and NIDA, or all 3 of them combined in one test, M3, PEG, and NIDA. So with the M3 test, a little bit different from all of our other tests, this one has to be ordered separately because it sends out a link to your client. For our purposes today, we are just going to order this M3 for mental health and add it to the cart. So I already have it in my cart, and I am going to hit check out. At that process, we would hit continue, and you would either select your patient from your drop-down list, or you're going to add a new patient. Simply hit continue. You would put in your payment information and process the order. When you hit process that order, an email is going to be sent to your client automatically. And let me show you what that email is going to look like. So I'm going to take off my clinician hat and I'm going to put on my patient hat. All right, so now I am talking to you as the patient. So in my inbox, I received an email from Virtual Clinic that says Virtual Clinic M3 checklist assessment link. Hello, Sally. Your clinician, Ms. Krebs, has ordered the following, and there's a link. Super duper easy. I simply, as the patient, am going to click on this link, and it's going to open up a form that is specific to me as the patient. A little welcome message here. I'm going to click next, agree, next. All of this information has been pre-filled out for me. Except military status, I did not serve. And then as the patient, I am just going to click and answer these questions. Now, I'm just doing this to give you a little bit of information so that we have a score to review in the next step. Now, I will tell you while I'm drawing pretty pictures here, this test has been approved for insurance reimbursement. We do have those CPT codes available to you. And if you are a clinician who wants to incorporate this with your practice and take care of billing, then reach out to us directly and we can help you find the best way to get that set up, whether that's through a partnership with us, or we can help you directly if you already have a billing company, or if you need a billing company, we are working with a billing company. So there you have it. That information has been submitted. So now I'm going to take back off my patient hat and I'm going to put back on my clinician hat. So we have logged back into our dashboard and I am now the clinician. So again, we're going to go to test and you'll see this list here that says M3 checklist for mental health. That is where all of your results are going to show up. The very first result here is this checklist for Sally that I just did. Now you will notice some of these assessments are blue and some of them are red. The blue ones are the ones that have already been processed and come back. The red ones have not come back yet. So either the patient or client has not taken that assessment yet, and you or we can follow up with them to remind them to do so, or it just hasn't been processed. So it takes about 10 to 15 minutes for the AI algorithm to process that and send back the report. So I am going to go ahead and open Sally's down here from one that I did a couple of weeks ago. And I clicked on that blue link and it takes me specifically into her results. And you'll see down here is a red icon that's a PDF icon, and that is the file. So when I click on that, it opens up her results. So you'll see here this very first line has a overall M3 health score, 27. So that puts me overall, based on those 27 questions, at a mild risk. Now you can dig more into this and find out which issue, which mental health risk am I higher at. So if you scroll down here, you see that here's one for depression, that's a 7. So that's a mild risk. Also PTSD is mild and bipolar is mild. So this is not a diagnostic tool. It is a screening tool. It is to help you as the primary clinician for Sally to maybe start to see things that are not risen to the top yet. Or sometimes people aren't necessarily comfortable talking about struggles that they're having from mental health. So this is an easy way for you to screen your entire population, especially if you are one of those wonderful clinicians who are working with our military, active or veterans. Thank you for that work. And we know that military service tends to have higher risk factors for various conditions in mental health. Now, what you do with this information is where you get to be the glowing clinician that you are. If you are skilled in this area for mental health, then obviously you're going to know how best to help them with their next steps. If you're not, but you partner with a mental health professional in a therapist, psychologist, or psychiatrist, then this gives you that window that opens the door to have a conversation about referring this patient to someone to help them with that. But what we want to do is just put another tool in your hands to help you serve your clients and your community better. As we finish this video, let me remind you, if you do take insurance or if you are interested in taking insurance with this test, and reach out to me, let me know how we can help you onboard you with this specific test and help your clients and your community. Thanks for being a valued member of Virtual Clinic, and until the next launch of our new product, I will see you then.